Antibiotic-induced Achilles tendinopathy or tendonitis is usually a lot more painful than regular overuse tendonitis caused by sports. And it has to be treated a little bit more carefully than regular tendonitis. So in this video, I'm going to discuss the treatment options that you may find useful if your Achilles pain is because of antibiotics, and also how to adapt the traditional rehab you would do. For those of you who don't know me, my name is Mareka. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want a link to our website. It's really important that as soon as you notice any of the side effects that may be linked to antibiotic use like fluoroquinolones, you speak to your doctor immediately, because the current advice from the research is that that medication has to be stopped immediately. But usually a doctor has a really good reason why they prescribed it. So you shouldn't just stop it and then not tell them. You should first speak to them, and if they say it's okay to stop it. Now, if you're wondering why antibiotics would injure your tendons, I've made a whole video about how that works and what happens. So have a look at the description of this video if you want a link to that one. Now, normally we wouldn't tell patients to take anti-inflammatories when they have Achilles tendonitis or tendinopathy caused by overuse like sports or activity, because it's not that great for the recovery after that. And also it's been shown through research that there's not a lot of inflammation involved there. But this is different from if your tendonitis is caused by antibiotics. In the case of antibiotics, they can often cause a really dramatic inflammatory response in the tendon, which can make it really, really painful. So your doctor may very well prescribe you a short course of anti-inflammatory medication like ibuprofen or naproxen to just help calm that tendon pain down and allow you to start moving. So this advice is very different from what we would tell somebody with an overuse tendinopathy to do, but it can really be useful to have a short course of anti-inflammatories for this type of tendonitis. Like I mentioned before, when you get tendon pain from taking antibiotics, it can often be really, really painful. Now, something that can help you decrease the pain and the irritation of the tendon is if you can wear shoes that has a little bit of a heel on them. So the heel is just higher than the toes. Typical running shoes has a slightly higher heel than the toes. Or you place a heel lift insert into your shoe. Now what that does is, when we stand with bare feet or very flat shoes, our Achilles tendon has a little bit of stretch on it. Now when a tendon is irritated and injured, that usually just makes it more irritated. If you lift the heel slightly by putting a heel under it or a heel lift, you're taking some of that strain off it. So you're just giving it a little bit of breathing space. And this can be really useful for people with super painful tendons to allow them to walk around the house and even do daily tasks with less discomfort and pain. So my advice would be, if your tendons are really painful, don't walk around in bare feet, don't walk around in really flat shoes. Wear shoes inside the house even, with a bit of a heel on it, until your tendons have calmed down to the point where they're happy to walk around on flatter shoes or maybe even barefoot. Now, Alison has made a whole video where she explains this in a bit more detail about how heel lifts can work, so I'll put a link to that video in the description of this one as well. A very useful and important concept to understand when you've got an injury like a tendon injury from antibiotics is the concept of load management. Now, what do I mean with that? So once injured, your Achilles tendon loses some of its strength and endurance and tolerance to cope with the loads from normal activities. So if you try to do the normal walks you always did, or try to climb the stairs as you want, it's just not strong enough for it at the moment, or too sensitive to do it, and it just makes the pain go worse. So what you have to figure out is, what is it able to tolerate at this moment in time? And then we'll use that as the baseline and slowly build your rehab on top of that to get you back to what you want to be doing. So your baseline is the activities you can do in a day that doesn't increase your daily levels of pain by that much. What do I mean with daily levels of pain? Well, when you've got an injury, you've got a certain amount of pain that's going to be present regardless of what you do. That pain is just there to keep your mind on the injury, that you don't overdo things. It doesn't mean anything, it doesn't mean danger or anything like that. It's just there to say, hoi, look out for that part. Now, when you add new activities or you do any jobs in the house, the research shows that it is safe and actually really beneficial to keep moving and keep active as long as it only increases your baseline pain by about 3 out of 10. So it's feeling a bit more uncomfortable while I'm moving, but it's not causing me a significant increase in pain. And when I stop that activity, the pain comes down within a couple of hours and it's back to my normal baseline. That type of level of activity actually helps your injury to recover over time. And it's better than complete rest, because with complete rest, things can actually start to feel more uncomfortable and more stiff over time. Now, important things to keep in mind is that if you're quite used to doing gentle things around the house and you want to add in like walks or get back to normal life, don't go from this small volume to doing a large amount, because that step is too big. You've not prepared your Achilles properly for that step. Do it in little steps. So if we take walking, for instance, because it's an easy one to think about, you'd go for, can I do gentle walking in the house for all the tasks I want to do? Boom, tick that box, that's easy now. Okay, then I want to start actually building my tolerance for continuous walking outside. So I may start with a gentle 10-minute walk. Now at the start, that may feel a bit uncomfortable, but as you continue with it a few times a week, your tendon gets used to it and that becomes easy. Now, you don't want to go and double that and say, okay, now I'm going to do a 20-minute walk, because that may be a jump too quick. You want to go a smaller step, like say, I'm going to do 5 minutes extra. So I'm going to do a 15-minute walk. Same thing with speed. Remember, if you're walking fast versus slow, it's much harder work for the tendon to walk fast. So if you're only doing slow walking, don't go and try and do a power walk then for that full time. You've got to first build your slow walking tolerance and then slowly add some extra speed to it. So very important concept to think about for everything, because the same is, you can't just rest at home for 5 days, feel much better, and then go full on back to work and be up, down, up, down. That's going to make your tendon feel worse because you've not prepared it for it. So think about load-bearing capacity and how to get back to the bit you want to do. And that's part of what we do for our patients. We help them assess everything they've got to do in their job and their life, not just their sport. Some of them don't even do sports. And we help them figure out how to safely get back to all of that. To fully restore the strength in your tendon, you will have to do some tendon-specific exercises as well. But again, these are similar exercises to what we would prescribe for somebody with an overuse sports type of tendonitis, but they're just a lot gentler. So typically, for someone with an acute flare-up from taking antibiotics, we wouldn't start strength training exercises within the first few weeks. We'll wait a little bit. And then when we start, we'll start with things that's more aimed at helping the circulation and the pain calm down rather than building strength at the start. So useful things for that is when you're just sitting and you're just in sitting with no extra weight, start to lift your heels up and down. So we're getting movement, because movement helps to decrease pain and helps increase circulation, but we're not forcing anything and we're only doing what those Achilles tendons like to do. So we're guided by the patient and we give them guidelines on to how to decide how to go on with that. From there, we may go on to double leg heel raises and then eventually single leg and load them up and everything. But we'll take that very slowly, because remember, one of the things that the antibiotics does is it inhibits your body's ability to rebuild and produce new collagen fibers, which are the building blocks of tendons. So even to the exercises, the tendon can't quite react as well as it would in the past if it didn't have the effect of the antibiotics to repairing your tendon. So you have to go a bit slower with the rehab and give it lighter loads for longer and take longer to build up to the main strength. But it's not really rocket science. If you listen to your patient and you look at how easy or difficult it is for them to complete the exercises, that tells you when somebody is ready to move on. So with these patients, I definitely don't want them to strain to get their repetitions done. I want them to be comfortable doing the full set that I've requested and build up to that over time and do it on several different sessions before I then add the next level up to that. It's better to take time with this than cause a painful flare-up, because having a flare-up just demotivates one so easily. So the key points here, to start with is just aim for circulation at the start. Don't start too early with the exercise, and definitely start with much lighter loads, and do not speed up the progression. Take your time. Then I will also say that really leave plyometric exercises like jumping exercises, hopping exercises, even running for at least 6 months after you've stopped taking the antibiotics. And the reason for this is that the research shows that people have an increased risk of rupturing for the first 6 months after they've taken the antibiotics. So I like to build the strength with my patients first, and carry on building strength until at least 6 months have passed and I've made sure they've got good strength in their legs before we add in plyometrics then. Something else to keep in mind is that to build strength in tendons takes several weeks. It takes at least 12 weeks of consistent heavy strength training for somebody who has a regular tendon injury to actually build significant strength in the tendons. So if we look at the 6-month guideline, that's half the time already when you're doing heavy strength training. And the other 3 months, you likely only build up to the point where you're ready for heavy strength training. So that's another reason not to rush the plyometrics in this instance. Then finally, I would say, I would always allow people slightly more recovery time when they're in the situation where the tendon was injured through antibiotics, just because we want to make sure that the body has enough time to repair the collagen cycle after they do strength training. So if they're doing heavy strength training, at least 2 to 3 rest days between sessions. There is some research that suggests that you may benefit from taking supplements of vitamin C or vitamin E when you've had damage to your tendon caused by antibiotics. Now, it's important to understand that this research is still very, there's only few studies to show, and we don't have enough to say that you definitely need it or you need to have these and these doses are perfect. So I would advise that you speak to your doctor and understand what is a safe dose of vitamin C as well as a safe dose of vitamin E before you start taking any supplements, because you can actually overdose on these things and cause other problems. But yes, if they tell you that it's safe to take it, I don't see much harm in taking a safe dose of those. Excellent. Hope you found this useful. And remember, if you need more help with an Achilles injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.